If you're a health practitioner in British Columbia, Canada, things are about to get really, really saucy for you and not in a great way. In this video, I'm going to share with you 5 pending changes that are coming starting in April 2026 to BC practitioners and what that means to you in your business and your livelihood and what you can do to circumvent some of this nonsense that the government is imposing on the profession in BC. My name is Duriel Kim. I'm the CEO and founder of Healthpreneur. We help health practitioners build scalable practices both in person and online. And unfortunately, when stuff like this comes out, it's a reminder of how little freedom many regulated professions have. Now, I think we all experienced COVID, shutdowns, the pandemic, the whole bit. And I think that was a really frightening glimpse at what's possible under government's restrictions, oppression, control. And the good and bad of being a regulated health professional is that, number one, people trust you, right? You went to school for a long time. You have, credibility out of the wazoo. But with that, with great power comes great responsibility, as they often say. And unfortunately now, specifically in BC, now again, who knows if this is going to permeate to other provinces or states, this is not ideal for practitioners. Recently, we actually had a call with a practitioner who was interested in having us help them grow their business. And she was mentioning that one of her colleagues had been talking about 6-month jail time, $250,000 fines. I don't know if that's exactly the case in every situation, but these are the things that are coming about. So I want to share with you 5 changes you need to be aware of if you're not aware of this new Health Professions Act. You don't need to read through the whole thing. It will take you days to get through all this nonsense, but I'm going to share with you 5 important things you should be aware of. So number 1 is that the minister can create panels to review your profession. Okay, so that's the first thing. Now, why are they doing this? I don't know. Control, quality control, call it what you want. I don't know. 2, and this is the bigger problem, is that a lot of these panel members are not practitioners. Think of it this way. So in our business, we have an amazing team of coaches and subject matter experts who build out business, marketing, et cetera, assets for our clients. Now, we do our very best to do a QC on everything that we provide for our clients, whether it's a webinar or emails or ads or whatever it is. But we can only QC that, quality control that, because we are experts and we understand the nuance of what good looks like and what not good looks like. Unfortunately, what is happening here with the Health Professions Act update in BC, it's almost as if I had my kids or anyone not related or have any expertise with respect to business or marketing review somebody's webinar and say like, yeah, that's good enough, or that doesn't make sense, this is terrible. And so this is a very, very big problem, because if, the people that are overseeing your business, your livelihood, don't have nuance and context and expertise in that profession, whether you're a psychologist, a therapist, a doctor, that's a really big problem. So that's the second thing. Third thing is they can influence what you do and what you're allowed to call yourself. Now, for me, this is, what you do, obviously it has a big impact on what you do, but what you call yourself maybe is a little bit less relevant. So in 2005, I was sick and tired of the one-on-one grind. I was working 12 to 14 hours a day, and I wanted to move my business online. So at the time, I was a strength and conditioning coach, I was a nutritionist, I was a certified kinesiologist, and the Ontario Kinesiology Association said, hey, you cannot take your work online. Like, if I'm still going to keep the CK behind my name. And I said, cool, take your CK and shove it. I don't need your CK. I don't need this. I don't need to be a certified kinesiologist to know how to do that stuff. And so I made the decision to basically eliminate those letters behind my name. But what they can never take from me is my skill set. So do I need to practice kinesiology with someone virtually? No, I don't care. But do I have the know-how of how someone's body works? Of course. So this is a choice that you get to make at any point of your journey in this profession. Like, again, we've worked with thousands of practitioners who've come online and they're all worried about like getting slapped by their governing bodies. I'm like, it's in my 20 years of doing this, not once has there been a single issue. So if a medical doctor or a naturopath or a chiropractor comes online and they're like, well, I'm scared of like my license and all this stuff. It's like, cool. Then you can work as a health coach. You can call yourself a health consultant. You can call yourself a longevity expert, right? What's the big deal? Right? So like, again, it just allows you to free yourself from the nonsense if you want to. Now, I'm not saying you should do that. I'm just giving you an example of what some people do. But again, you can still practice medicine within, your licensure in terms of whether it's the state boundaries or whatever else. But again, I'm sharing this because it's just more imposition of control for them, less for you. Okay, your college, so like for instance, the college for chiropractors, right? They can have a say, they can comment on certain things that are happening at the governmental level, but they can't actually decide. So the ministry is kind of like overriding what the individual colleges can do. And again, it's like, why? They don't have the expertise. The colleges are a little bit closer to the trenches. They understand, what it is you're going through. And number 5 is that it opens the doors for bigger changes later. Okay. So this is the thing is like, this is one step in the wrong direction, and it's not like they're going to go backwards typically. Okay. So these are 5 imminent changes. I wanted to kind of like distill it down into, relatively simple language for most of us to understand. So basically what it means is tighter control, more oversight, more regulation. And if you want to live in that world, that's up to you. But what I want to share with you here in addition to this, okay, so it's like, okay, if you're a practitioner in BC, what can you actually do about this, right? So it's like, okay, good to know, but what do I do about this? Now, I'm going to share 6 things to think about. Whether you do anything with them or not is completely up to you. So number 1 is stop building a business that lives in the system. So if all of your income relies on you doing work that is, let's say, codified, insurance-based, like requires to be inside the system, you are always going to be at the mercy of that game. Again, I chose to leave the system in 2005. I call it the medical matrix. I left the medical matrix, but what I never left are my skills. I still no one can take your knowledge and what you know how to do with people. Yes, there's going to be a couple nuances of things you can or cannot do if you're outside the system in terms of maybe access to labs or different things like that. But for the most part, this is an important consideration are you willing to build a different business or an adjunct to your business that is outside of how things currently work inside your scope of practice? I'm not saying you have to, and I'm not saying you have to go on the side and start selling drugs. Like that's like cocaine. We're not playing that game. I'm saying there are legit ways to build a business that helps a lot of people, i.e. a coaching business that is open to anyone. Now, you can say, well, coaching is not regulated, and that's a problem, which I 100% agree with, right? Easy in, easy out. Anyone can call themselves a coach. Heck, Beachbody with Shakeology, right, which is basically an MLM offer. Here's a shake. You can sell it to your friends, families, and neighbors, and you call yourself a health coach, not a distributor. So the very fact that anyone can call themselves a health coach, I completely understand that it is an absolute status shot to your expertise. I get that. I totally do. But the reality is, if you're not willing to step away from that ego, not saying your ego, but the mind's ego of staying very, very attached to a label of being a doctor, of being a licensed professional in this scope of practice, you will always be limited by that. And if you move into this world that is less regulated, which is essentially coaching people online if you want, it doesn't mean that you're doing bad work. It just means that you're in a system that is just a little bit more free. And again, the problem there is that anyone can call themselves a coach, but when you can tie in your expertise and experience, people will start to recognize very quickly who's legit, right? Again, all of our clients are world-class practitioners, and a lot of them are just I'm sick of this nonsense. They left the hospital system, they sold their clinic. Some of them straddle both. So they do in-person work in the clinic and they're building out their coaching business at the same time. Some of them continue to work as licensed within whatever they do, virtually within their state or their province, and others are no, I'm going to work as a health consultant across state lines. So again, the first thing is whether or not you're willing to build a business, take your expertise outside of the current medical matrix. Second thing is building leverage that cannot be regulated away. And this is where one of the first things you have to be aware of is you should be getting paid for what you know, not just what you do. Even outside of regulations, one of the ways that we help clients with their brick and mortar is helping them understand you don't actually need more patients, assuming your practice is doing well. The problem is that you can't scale a practice because you have no capacity to do so. And you don't have capacity because all of the care is one-on-one. And that's a very unscalable and unsustainable model. It's not good for the patient and it's not good for you. If you don't agree with me, totally fine. I've got other videos that talk about the downsides of one-on-one for both you, your patients, and your business. I'm not going to get into that here. But what I'm saying is, in order for you to have more freedom, you have to build care in a way that's more leveraged. Leverage doesn't mean less impactful for your patients or clients. It actually, when it's done properly, produces better results for them. So when I'm talking about like leverage what you know here. It's like, how do you take your intellectual property, what you know, and build out programs, right? When you take frameworks, you take, okay, there's probably a more effective way to help your client get a result or your patients get a result. So let me give you an example. So let's say I was talking with a client of mine who, busy chiropractor in New York, great guy. He can't even take time off because he's so slammed. So I said, okay, well, you probably see, everyone under the sun, but what, like, if there was one thing you can do, like one problem or condition that you could solve, like no problem with your eyes closed, what would that be? And he's like, frozen shoulder. I'm like, great. Okay, so number one, are there any contraindications for frozen shoulder in this case? And he's like, no. And we're going for a walk, at my place in Mexico as we're talking about this. And I was asking him, like, okay, let's say that I'm your patient and I have frozen shoulders and I end up bumping into you in an elevator and I've got 30 seconds of your time. And I say, hey man, I've got frozen shoulder. What's one thing I can do this week to help alleviate the problem? And he has to answer me before the doors open on the elevator. And so he said this, whatever this was. And I was like, cool. So what you just told me is the first thing you're going to have someone do in week 1 of them coming to see you for this condition. Okay. And what I was trying to get him to think about and what I'm trying to get you to consider here is that you hold so much knowledge and expertise that you think it has to be overly complicated or that you have to be the one delivering it. And I'm not saying that you specifically, I'm just talking about us as healthcare providers because we have so much knowledge, we take it for granted. I mean, step 1 might be just go for a walk 30 minutes every morning. It's like, well, that's too basic. Yeah, well, here's the thing, okay? The reason people are not doing this is number 1, they don't know, or number 2, they do know and they're not doing it. And that's fine, right? As soon as they pay you money, they will do the thing they know they need to do, but are not doing it. So that's another consideration. So let me go back to the frozen shoulder story. So what I'm trying to get at here is I'm trying to help him unpack how you help somebody with frozen shoulder if they don't come to see you. So week 1, let's say I have to do some type of exercise, okay? Now, instead of me going in to see the chiropractor 3 times a week, I'm gonna see him once. And he's gonna give me one thing to focus on every single day because I'm a noob and I don't know about the human body. I don't know what to do. I'm not gonna have this comprehensive 5 exercise program that's gonna take me an hour a day. No. One exercise. It could be a stretch, it could be a strengthening movement, it could be range of motion, it doesn't matter. And it's gonna take me 5 to 10 minutes and I'm gonna do that every single day for the first week. Now, what do we do in week 2? So let's say I've built the foundation of whatever this exercise is, my shoulder is feeling a little bit better. What's the next thing I, as the patient, am going to do to make progress with this shoulder? Again, you as the practitioner are thinking, okay, well, what would be the next logical step? Okay, probably we start there and then we'll move to this. So now we're moving into skill or habit or exercise or stretch number 2. And now what we're doing is this is something we call skill stacking, or in our case, how we build a curriculum. In this format, we call it the 1-by-1 method. One thing, 1 week. And as a practitioner, you don't spend 3 sessions a week with someone anymore. You only need to see them once. Because now they'll make better progress on their own or like whatever, it might be twice. So here's the thing, is that if you see a patient 3 times a week and you can get that down to 1 time a week, what does that do for your time? Does it take up more of your time or less of your time? It takes up less of your time. And is it because you don't care about them? No. What I would argue is people, and listen, I've been both a provider and a patient. I've been on both sides. So when I go to a chiropractor and I'm like going there for months upon months upon months, and I'm seeing them 3 times a week, and I'm making little to no improvements with whatever the issue is, that's an ineffective model. What if I went once a week, not because the chiropractor didn't care, but because he cared so much that he gave me a self-directed curriculum, very simple things that I could do on my own that I would actually now do because I'm paying. And as I'm doing these things on my own, whether it's soft tissue work or some light stretching or some strengthening, when I see him, I'm making progress on my own. This is what I'm talking about, leveraged care. Okay, the one-on-one model is completely obsolete and it is not good for you because you don't get paid when you're not there. And it's not good for your patient because they don't get better when they don't see you. Okay, so third thing is to separate your income stream from your scope of practice. This kind of ties in with what I just talked about. If you are solely in practice in person and you're regulated, that's your choice. What a lot of people do is they start to want to talk about building passive income online. So they build up these courses that no one knows about and no one buys. But the idea is that you start to have some type of offering outside of your practice, maybe as you're building out an online presence where now you can help people through this slightly different vehicle. Okay. So that way that gives you a bit more control, a bit more freedom. If you take a week off, if you want to go on vacation, you still have this thing that's helping people and making money. Okay. Number 4, this is a huge one, is you have to start to really build your own asset and own your audience. So if you have a social media following, if you have patients or whatever it is, you have to start building a database of contacts, email list, patient or client list, getting people off of social media into your world, a way that you can build community and start to provide value for them so that whatever direction you take in the future, you still have these relationships that you've nurtured over time. If you currently have a patient list, if you're not emailing them at least once a week with some type of value, you're missing the boat big time. I promise you, if you want to grow your practice and you're not super slammed already, the easiest way is using one of our fast cash campaigns, which is essentially you have an email list or a patient list of hundreds or thousands of people that are never being communicated to from you, maybe. And so with our fast cash campaigns, we literally just give you here's the email campaign to send people with a specific offer. And it's like, oh my God, I just enrolled 10 new patients. Done. Okay. So you have to build relationship with the people that are in your ecosystem. So number 1, if you're not collecting emails, please start doing so. Build your email database. It's the biggest asset your business will have over time. Second is email these people at least once a week, add some value, make their lives a little bit better so that when you do make an ask, then at least you provided value and there's some know, like, and trust. They're more likely to take the next step with you. Number 5 is you got to learn the business and marketing skills. Now, I understand you're busy. You probably just want to see patients all day long. I get that. That's fine. But you'll never create freedom if you don't understand how to grow your business. You're a great practitioner, but in order to achieve true freedom, both financially and time-wise, you have to be a great CEO. And that doesn't mean your business has to become all corporate. It just means you have to understand how to run a business. You have to learn the business and marketing skills. You have to run your business by the numbers. You have to learn how to build a team over time, depending on how much you want to scale. Because if you're not willing to learn these skills, then you will always be at the mercy of other people who have them. And when those relationships don't work out, you're always left with your pants down back at ground zero. And that's not a good feeling, okay? So, I've got other videos on this channel. The reason we exist, Healthpreneur as a company, is to help practitioners and health, experts build not just the right systems in their business, but also equip them with the skills to understand better communication, to understand marketing, to understand sales, to understand packaging and positioning. Because listen, it's like the best practitioner doesn't win. I hope you understand this, right? It's the best known practitioner wins. And that's a marketing game. Period. End of story. If you just have an ambition for more, it's just an imperative skill set to build. Okay. And then the final thing is just thinking, get outside the box and think long-term, not around just compliance. So please understand that there is a version of you that is significantly bigger in terms of revenue, impact, and freedom that is not going to be accessed if you continue to be handcuffed by regulations. And I'm not saying you have to go rogue and do all sorts of stuff that's non-compliant and against the law. And by no means, I don't want you to get that impression. But what I am sharing with you is that there are ways within your practice, or in the less regulated sense of a coaching type of label, to help a lot of people in a really profound way, in a way that gives you a lot more freedom of what you can do and work from wherever you like, right? So it's if you're not willing to see the world outside of what it's currently looking like, then you just have to accept what it is. Or you could take maybe some of the ideas that I've shared with you here to be okay, what could this look like? Who are other people who have done this? How can I learn from them? Because if other people, not just a few, but there are thousands or tens of thousands of your colleagues that have built remarkable businesses that don't reside inside this system that is completely corrupt and inefficient. And they all came from this system to begin with. So if you just know what you're doing right now is just not getting you where you want to go, it's you got to do something different. And so I'm not saying you have to close your practice and shut it down and move online. I'm not saying that at all. I'm sharing this with you because coming in April, depending on when you're watching this, maybe it's already passed, in British Columbia, things are getting tighter, right? And again, it's just it's only moving in that direction, right? There's gonna be more regulations, more tight controls, And, maybe this is a warning flag to say like, hey, maybe this is an opportunity to start to consider what else I could do in conjunction with this, how I can support what I'm currently doing in my practice to now work with people in a way that's a little bit more liberating for me. So anyways, I hope this is useful. If you're in any way, shape, or form interested in how we help clients, there's a link to the next video. It's called the Millionaire Coaching Model. It'll give you a better sense of how we help practitioners and coaches, scale their businesses virtually. Hope you've enjoyed this. If you have, hit subscribe to the Healthpreneur channel. We've got hundreds of other videos to help you build your dream in the service of more people. But for now, I'll see you in this video over here.